Last year, I spent 6 months making a short film about Michael Stick, whose mentally ill son fatally stabbed his mother while hallucinating. I followed Michael as he fought to get his son a ruling of not guilty by reason of insanity, which would mean he would go to a mental health care facility and not prison. As I worked on this project, I quickly learned there were many other cases like the Stick families.
This has been the bloody summer of 2015. And although these are the incidents that get the headlines, it is a tiny fraction of the tragedies that occur in the area of mental illness that is untreated.
Mental illness is actually much more common than many people realize.
Typically what we say is it affects 1 out of 4 people. People who are in treatment are many times unrecognizable because they look just like anybody else.
1 in 4 people suffer from some sort of mental illness. So if it was 1, 2, 3, 4, it's you, sir, you. Yeah, with the weird teeth, and you next to him. You know who you are. Actually, that whole row isn't right. That's not good.
So since mental illness affects so many people, shouldn't there be an effective system in place to treat it? The condition of mental health care actually varies a lot from state to state, because individual state governments are the ones that decide things such as funding for mental health care in their states. So today I visited the state capitol in Oklahoma City to attend a budget hearing for the Oklahoma Department of Mental Health and Substance Abuse Services to see what was going on with my state department for mental health care.
There's no money out there. I have neighbors that come up to me and they'll just say, well, there's just no money, so tell them to get over it.
Only 39.5% of our adults received treatment or counseling in the past year for their mental illness, which means 60% of Oklahomans struggling with severe mental illness weren't getting the help that they need. Mental health is the leading health reason for lost work performance. It also accounts for 30% of the disability costs that our businesses have to come up with every year. These are the biggest public health issues facing our state.
And it's not just Oklahoma. Most of the states just don't give much toward taking care of the mentally ill.
So what are the issues that keep us from having an effective treatment system in place? What do you feel like are the main issues with the way that mental illness is treated right now?
You have a couple hours.
I could go on and list a list of them.
Oh, I wish I had the answer to that question, and then we could fix it.
At the state budget hearing that I sat in on, Commissioner White spoke on what some of these issues actually are.
The problem that we have is that the door to get into the system is so narrow that there are 2/3 of Oklahomans standing on the outside of the door who need help, and only 1/3 of the Oklahomans inside the door who need help.
People contact us and they're not sure where to turn.
Insurance in the past has not paid well for mental health services. So it's more out-of-pocket expense for most people, and it's not cheap.
For those who get services, the outcomes are really good. The problem is we don't let enough people through the front door to get the help that they need. My 18th birthday is in the summer of 2016, which means that I'm going to get to vote in the 2016 general election. And I'm looking for a candidate who's going to address this issue. So I did some research, and I prepared a presentation of all the different candidates' plans to address mental health. The only time it has even been mentioned by any candidates has been as a way to dodge discussions on gun control.
This isn't guns, this is about really mental illness.
In many of these shootings, we have people who have mental disturbances.
Do we need to do a better job in mental health? You bet we do.
Yeah, it seems there is nothing like a mass shooting to suddenly spark political interest in mental health. Although it's worth noting that Governor Huckabee's state got a grade of D- on mental health care while he was in office. And you can't lecture people on something you got a D- in. It's like passionately delivering a speech on proper English grammar by saying, we need to thunk better about how we does word stuff. We need to get it did.
So if mental illness is such a big issue, why is it not being addressed effectively?
It's still very stigmatized.
If I walked up to you like this, you would likely understand that I had a physical impairment and wouldn't think that there's anything wrong with me as a person. But if I walked up to you like this and were suffering from a mental illness, you might not understand that I'm still suffering from something that's outside of my control, and you could easily misinterpret it as being in a bad mood or having a character flaw.
I think stigma is a word that is lacking. Prejudice and discrimination, now those are words that are getting at the truth.
The other reason mental illness typically goes unaddressed is the fact that it would lead to more costs for the taxpayers. But what many people don't realize is that mental illness will end up costing us money no matter what. Unfortunately, if you're currently in a facility receiving treatment for mental illness, the odds are you're probably dressed like this.
Our jails and prisons are our main place now where you find mentally ill people.
This is a population that people don't care about, and so as a result of that, there are not the resources out there to care for them. I've got probably 2,500, 2,800 people with mental illness in my jail today. And you look at their backgrounds, they've been in here 50, 60, 100. We have some people who have been in here 400 times.
You're saying the prisons and the jails are the new asylums?
They're absolutely.
So let me put it like this. In my home state, the average cost of preventative treatment annually per person is about $2,000. That's the cost of one C-SPAN Second Prize Award plus the Fan Favorite Award. However, the average annual cost of incarcerating somebody is about $19,000. You'd have to win the C-SPAN Grand Prize 4 times in a row in order to make that much money.
It's a shame. The outcomes are terrible. We have to change.
We're really, really, really good at saving drowning people in the river. We don't seem to be allocating many resources and keeping them from falling in the river in the first place.
Presidential candidates, this is an issue that affects lots of Americans, and it's one we can't keep ignoring without having more tragedies and costs to the taxpayers. We need to be allocating more money for mental health resources and educating people on the reality of mental illness. Let's do something about this.